Okay, so everybody to our November Human Service Council meeting. So glad to see you all. It is really fall. The leaves are orange, red, and all the yellow and pretty colors, and it's sweater weather. I am so glad to see you all. So without further ado, we're going to get started. I want to welcome someone really special, near and dear to my heart. She's amazing in our community, does so much. But her name is Kiona Towns, and she's the Family Service Coordinator at the Bloomington Housing Authority. She works with the low-income population to promote growth, opportunities, and stability. Her official title is the ROSC, Residential Opportunity and Self-Sufficiency, a HUD-based grant. Kiona planning to talk to us about the ROSC program, who qualifies, collaborative opportunities, and community partnerships. So without further any more, go forth, Kiki. I'm so proud of you. The floor is yours.
Good afternoon, everybody. Partners, neighbors, collaborative friends. It is definitely, I take this as a great opportunity to be able to speak with you all concerning the programs that we offer at the Bloomington Housing Authority. As Dorothy has already stated, she's kind of gone over the job title and just what we do at the Housing Authority, but let me kind of just open up the door for you to understand a little bit more about our program. So she did give you the acronym, which is ROSC, and that is ROSS. ROSC stands for Resident Opportunity and Self-Sufficiency Program. And that's exactly what it is. We set up opportunities to present opportunities for self-sufficiency for our residents. We have just a little bit of feedback in the background, so if you are not on mute, just go ahead and mute yourself so we can go ahead and finish the presentation. Thank you so much. The ROSC program was designed by HUD to not reinvent the wheel, but to supply opportunities for job readiness, coaching, case management, and also opportunities for people to build upon what they currently are doing or more. So what we offer is employment specialists to come in. We have had evaluations on our programs to see what we're doing, what we can be doing better. At the current moment, we have about 247 occupied units. And so I do work with the single and family population. And so we have about 247 out of our 250 units that are occupied. And we are also working off of a waiting list. So we are currently looking to fill those spots as soon as possible. So with that being said, we also have, and I printed that so you can get an understanding about how many people we serve. So out of those 247 households, there are 179 families with children. There are 383 children, and there are 670 people in total. Now, we do understand that our partners that work with us at the Housing Authority are serving our population. And so those population of people are getting childcare services, they are getting legal services, they are also receiving services for health and wellness. And so you are already doing the work that is necessary in order for them to gain some form of self-sufficiency, even if it's helping with barriers or helping to remove barriers that can help them to continue to obtain self-sufficiency. We all understand that in order for us to go to work as a mother and or a father with children, you need to have childcare available. You need to be able to have your children in after school programs if necessary. They need to get different clinical assessments, whether that's hearing or physicals and just day-to-day wellness. And so you all are a big part of what makes our programs operate. And we understand that we are a full circle with wraparound services for the community. So that's a little bit about ROSC. We are a grant funded program by HUD. And so those are the things that we do for our residents. Now, how can you help? As an organization, we want to yield success. And so our partners help us to gain that success. And so if you are an agency that is currently employing individuals, or if you are an agency that works with low income populations for school, apprenticeship programs, if you are an agency that is working on job readiness, coaching, if you're working on backgrounds and expungements, any of those things, you will be a big help to our program. If you are an agency that has childcare programs, childcare funding, medical, anything that can help our residents continue to be successful, we need your services. How can you get in contact with me? My information is linked in the chat. My email will be found in the chat, as well as my phone number. If you are a part of the Human Service Council, generally my email is linked in the rest of the email attachments. And so I would love to partner with you, find out what your agency is doing, sponsor some of those events, be a part of those events, sit at the table for some of those events, so we can get our families the services that they need. If you have any questions for me, even if those questions about housing, how do I start the housing application process? I have a family that may be interested in housing. You can ask me those questions at this time. If you have clients that you know are being served by public housing, but they are not receiving these services, you can ask me how and why they're not receiving these services. I will answer the why. I do have about 250 residents, but out of those residents, no one is required to be in my program. So that case management program, or, setting up goals, talking to a case manager, is solely based upon the interest of the resident. And so if you have a client that you know is a resident of the Bloomington Housing Authority and they have a need, whether they are working on all these goals already and they have a transportation gap, if they have a barrier with paying co-pays for childcare, if they have a barrier with getting school material, my grant does allow me to cover some of those expenses. And so if you have a resident that is already working on these goals, how about we collaborate and, we partner on making sure that they can complete those goals. And then the last part of this is that we also offer workforce and job readiness programs about 3 or 4 times a year. We work with the Section 3 program that is granted through the CDBG grant. We host those a few times out the year. Some of the partners that are here today has come into partnership with us for those programs. If you have any clients that need to attend some type of program that is accessible to them and they are a housing authority resident, then you just reach out to me, or I will connect with you and let you know what's going on. If there's any questions, please feel free to chime in at any time. You can add them to the chat.
Hey, Kiki, it's Shannon.
Great.
I'm from Lifestyle. 2 things. Can you tell me the acronym again, like what the words are? And then also how many residents are currently taking part in it?
So ROSC is Resident Opportunity and Self-Sufficiency. We currently, out of the 247 residents that we have 64 participants in the ROSC program. And so that is a great number, but as far as active participation, those numbers kind of dwindle down. But we don't expect someone to be active all the time. So if you don't have a need for childcare assistance, then that's good. That childcare assistance can go to someone else that may have that need. And so an active participant doesn't always mean I may not speak with that participant this week, this month. I may not speak with that participant for maybe 6 weeks, but they are actively still doing what they need to do.
Hey Kiki, hey everyone. Thanks for the presentation. It was absolutely informative and I just love to hear you speak anyway. But so the eligibility, I know Bloomington Housing will have their own income eligibility requirements. Is there anything different for this program? Could you speak a little bit about those eligibility requirements for those who already currently live in Bloomington Housing?
So when you say Gaynette, and thank you, when you say eligibility, are you asking, is there any financial restrictions for the program?
So financial restrictions, that they have to stay in the that they have to live in Bloomington Housing for a certain amount of time, that they have to have children. Like, are there any specific eligibility requirements that we may want to be able to communicate to people when we're referring over?
That's a great question, Gaynette. So in order for a participant to be a part of the program, of course, they need to be a resident of the housing authority, but they don't have to be head of household. And so as long as they are 18 years or older and they are a current member of the household, and that current member doesn't have to have a status, so that current member does not have to be a child of the resident. They could be roommates. It doesn't have to have a specific status. As long as they're 18 years or older and they're on the lease, they can be a participant. Did you have another, was there another question that I missed?
The follow-up. So if two people or everyone in the household that's over 18 participate in the program at one, okay, perfect.
Yes, yes. Um, there aren't any stipulations about how many people we can serve. The only thing that, of course, we keep confidentiality intact. If they're in the same household and they are on two different caseloads, we keep confidentiality intact.
And so Kiki, you did say, I apologize. Were you finished answering your question? Okay. And Gaynette, were you finished?
Yes, I actually am. I just wanted the contact information, but I'm sure she's gonna give that. It's in the chat already.
Yes,
Perfect.
it's in the.
And so Kiki, with one of the requirements being a member of the Bloomington Housing Authority, what is that requirement to become a member?
Okay, so if they are currently a resident of the housing authority, then they can participate in the programs that we offer. They can also participate. Now, there is a caveat to that. So if they are a Section 8 participant, now I cannot serve a Section 8 participant in the ROSC program. So when I say in the ROSC program, they can't be a part of that 64 that I'm actively serving. And so they wouldn't be able to receive any type of stipend or financial gain that comes from that program. I can't sit down and case manage them. But if we have a career service program, or if we're having a Section 3 program, we are looking in a few months to look towards some programs for the youth, and if they have any children. So if they are a Section 8 participant, they can participate in those programs like a community member, but they wouldn't be able to receive the additional services. And they wouldn't lose on services because we have the FSS program that is geared and catered towards the Section 8 program participants. And I'll leave that to Janessa to talk about at a later date.
Thank you, Kiki.
You're welcome, Andrew.
Kiki, I have a question. It's not exactly related to the ROSC program, but with the housing and eviction situation in our community, what is housing seen? Are they evicting people too? I mean, you go by somebody's income, but that doesn't mean everybody's able to pay it. So I was just wondering how that's affecting and the program overall.
So how we have been working with our residents through this pandemic is providing resources, connecting them to the resources that's in the community. There are certain programs that were not offered to housing authority, like you had the state programs that were offered. They were offered to they were offered to, and I want to make sure that I'm stating this correctly, anyone whose rent wasn't subsidized. And so our participants were not able to take part in those, but we made sure that we were giving out as much information that the community partners were giving us to make sure that they were able to pay their rent. Also, anyone that's living in the housing authority has the ability to reach out to their property managers and get on what's called a repayment agreement. And they work with them on those repayment agreements. And so as far as eviction is concerned, my program also offers opportunities for eviction prevention. So if you have a client that's currently in the process of eviction, they can reach out to me. If they're a housing authority resident, they can reach out to me and we can sit down at the table and try to figure out what things that are available to them to try to prevent the eviction. I work really closely with our property managers to, get some ideas and hone down on what's going on, and then, work with the resident one-on-one. Did I answer your question, Dorothy?
It did. Thank you.
Okay.
Well, any more questions for
think-
Kiki?
Lois had one. You're muted, Lois, if you don't mind.
It's Lori, but that's okay. I just want to let you know, because there's new funding for rental assistance just as of yesterday. They funded it November the 8th. The Treasury Department and whatever, they put now a whole new pot of money in for rental assistance and utility assistance and also mortgage relief. So they just, for a while, we went through that and just didn't have, I have a lot of things since I'm the pandemic navigator and people ask for resources and I used to have to say, sorry, no money, we ran out. They just funded it again just yesterday. A new pot of money came up on November the 8th that we can help with rental assistance. And then also there are some mortgage available to people need mortgage assistance, just to let you know. And the other thing is we have a lot of people that have different counties, and I guess we're not too bad, but they were having a whole bunch of evictions in Peoria County. In fact, someone said it was a lady and her handicapped daughter was evicted, and they're like, we couldn't figure out how that even happened. So they were going to collaborate with all the pandemic health navigators and just maybe work with the judicial system, because usually most judges know each other, and just say, because there's McDonough County didn't have any, but Peoria County had a lot. So they're trying to coordinate with, maybe resolving this with this eviction thing. And also maybe this new pot of money for rental assistance could help. But anyway, just wanted to put that out there so people would know.
Lori, can you put your information and contact so people, if they want to reach
Sure.
out?
Sure
in
can.
the
Sure
chat.
will. I will do that. Thank you.
Thank you so much,
Lori?
Lori.
Is that
Yes.
money related to the announcement they put out yesterday about the system being down and now you can apply until December for that?
I don't think so. I mean, I just read it I was looking at it Saturday because we have something called Slack with the communication channel for the Pandemic Health Navigator. I
Okay.
don't think that has anything to do with it. Usually, it's, you can use to, they had a lot of people that they had 7,000 applications and only, 5,000 people that they could apply for. But I'm just saying, sometimes you have to wait. But I know they had 2 different puddles of money. So now the new one has just got funded on the 8th. So that's a good question. That I can tell you, I don't think that's the case, but perhaps. I don't think so. I think it's available.
Thank you, Lori. That's good information. I think everybody on here appreciates it. So thank you. And Kiona, any more questions for Kiona? Or else I'm going to let her go because I know she has another meeting. And Kiona's put her information in the chat. So if you want to reach out to her separately, you can. So thank you again.
Thank you, Kiki.
Thank you.
Thank you all so much for your time. I don't think I've been called Kiona in one session that many times. God bless.
I'm trying to be professional.
Kiki.
4 times you said it, I said, who is she even talking to?
Oh,
Okay, well, it was great seeing everyone. And if you have, like I said, if you have any more questions, I have tons of information on the ROSC program. Sorry that I had to cut everything so short today, but if you have any questions, please feel free to reach out to me because there is more information to come.
okay. Thank you so
Thank
much.
you.
We appreciate
Bye.
you, Kiki.